Hi, my name is Paige, and I'm giving a report on RJ, a 45-year-old male who lives in a group home and is here today with a caregiver due to medication non-adherence and increasing paranoia. He has not taken his prescribed medications, including lithium and bupropion, for about 3 weeks. His group home staff report that he's been sleeping about 1 to 3 hours per night and has become increasingly suspicious that staff are trying to harm him. He believes that they might perform surgery on him while he's asleep or contaminate his food, and he's now refusing most prepared meals. RJ has a long history of bipolar 1 disorder, diagnosed at age 19, with past periods of stability when he was adherent to his treatment. He also has a remote history of alcohol use disorder, but is now in remission. He moved into the group home about 5 years ago, after his parents became unable to care for him due to their own health issues. RJ is followed by a psychiatric nurse practitioner, but has missed several recent appointments, stating that nothing is wrong with him. He currently is refusing care, but does have a follow-up scheduled in about 1 month. He denies hallucinations, suicidal thoughts, or homicidal ideation, but his paranoid delusions and lack of sleep are significant concerns today. On exam, RJ appeared alert but disheveled with blunted affect and pressured speech. His mood was anxious and suspicious. Vital signs were stable, though his blood pressure was slightly elevated at 156/86, likely related to his poor sleep and stress. Pertinent positives include paranoia, medication non-adherence, and severe insomnia. Pertinent negatives include no active substance use, no suicidal ideation, and no auditory or visual hallucinations. Based on his presentation and history, my assessment is likely a diagnosis of bipolar 1 disorder with a current episode of mania with psychotic features, most likely triggered by his medication noncompliance. My differentials include schizoaffective disorder, delusional disorder, and substance-induced psychosis, but these are less likely given his chronic bipolar 1 history, current lack of substance use, and an abrupt symptom worsening after stopping his medications. At this time, I would recommend restarting mood stabilization and antipsychotic therapy. Given his current symptoms and lack of insight, he would need a medication that targets both mania and psychosis. Therefore, I would initiate risperidone 1 milligram by mouth twice daily, titrating every 2 to 3 days as it's tolerated, up to that 4 to 6 milligram per day dose for optimal control of manic and psychotic symptoms. According to the American Psychiatric Association, risperidone is an evidence-based first-line option for acute mania and psychosis in association with bipolar 1 disorder. I would also recommend coordinating with his psych mental health nurse practitioner to evaluate RJ's capacity for medication management, as well as restarting his lithium once he's more stable. It would be imperative to also have the group home staff monitor for medication adherence, sleep patterns, and potential side effects like sedation or extrapyramidal symptoms. Because of RJ's current symptoms, I would recommend follow-up with the psych nurse practitioner in 1 to 2 weeks rather than his appointment in 1 month to reassess safety, adherence, and medication response. If his paranoia escalates or he refuses oral medication, RJ may require inpatient stabilization.